is Dr. Lance Poston, who is co-project director of UK Healthcore, and Dr. Trisha Clement-Montgomery, who is our acting dean of students. They're here to discuss UK's approach to supporting students' health and well-being during the fall 2020 semester. Just as a reminder, we're going to be taking questions via email. You can send those to coronavirus@uky.edu, and we'll get to those questions as time permits. We've already received several questions, so thank you to members of our community who have sent those in. So we're going to go ahead and jump right in, and my first question is for Dr. Poston. Lance, what is Healthcore?
Yeah, so Healthcore is the university's central hub for testing, response, follow-up notification, and support related to COVID-19. So we're that space you can not only get structured support, but reach out to for questions, referrals, and again, that ongoing energy that is focused on making sure our campus stays as safe as possible this fall.
Great. Tricia, what should people do if they see members of our community not abiding by some of these health and safety policies?
I think one of the first things to note is that if students or staff, faculty, anyone within our community that is not being compliant, they can be held to the student code of conduct. And so we encourage anyone within the community that may be a witness to some of these things to actually go on our Office of Student Conduct website and fill out a report. One of the biggest things that we ask, and we want to make sure people understand, is when they fill out that report, if there's any key information you can provide in those reports, whether it's the name of the individual, the exact location, as much identifiable information as possible that could be submitted in that report, that would be extremely helpful so that our officers in the Office of Student Conduct can actually reach out and do an investigation should they find someone not compliant.
And that student code of conduct applies both on campus and off campus, right?
Absolutely.
Okay. Great. Lance, why are only asymptomatic students supposed to get tested through Wild Health? That's our vendor that has done testing for us on campus. And why is there a different protocol if someone is symptomatic?
Yeah, so we have two major locations or avenues for testing on campus. One, of course, is our Wild Health site that is a broadly available site for folks who are asymptomatic, meaning, right, they don't have symptoms that would relate to perhaps the coronavirus. And then University Health and Student Health is a location that is specifically focused on students who are symptomatic, right, having symptoms that might be connected to COVID-19. We try to separate those two areas so that we're not having symptomatic and asymptomatic folks, right, mingling with one another while waiting on testing. Also, we've got more structure at University Health provided by those physicians and nurse practitioners there to be able to provide quick follow-up support for students who are symptomatic.
Great. Tricia, what are some ways the university is providing support and resources to student organizations during this time?
There's actually a number of different ways. If you go to our student organization's website, they will list out all of these services. But one of the biggest services that we provide is a one-on-one consultation for all student organizations. And so as individuals are considering hosting events, a staff official will sit down and meet with you and talk about how you can do that in a safe and healthy environment for all attendees. There's actually also our Student Government Association, which is providing PPE grants to organizations that would like to host events and, again, do that in a safe and secure manner. Student organizations is also assisting with what we call wellness monitors who will attend events and help in ensuring that compliance is met during the event, which is also pretty huge. And then in addition to that, should an organization want to recruit for their particular event or would like to advertise and showcase their event to other students, we also have what we call the involvement fair, and that's being done virtually so that organizations can encourage other students on campus to get involved and participate.
Great. Now, we talked about the student code of conduct, which is kind of on the individual student level, but what happens if a student organization doesn't follow some of those guidelines and health standards?
If a student organization does not follow healthy and safe guidelines, they too can be held to the student code of conduct. So very similar to the process that I described in the first question, we want to encourage individuals to actually report any concerns that they may have in organizations not following compliance. But there is a number or a threshold of different sanctions that could be applied if a student organization was actually found non-compliant. Those things can range anywhere from revoking an organization status to possibly a warning and having that one-on-one consultation. So we strongly encourage if a student organization is not being compliant to absolutely report that, and they would be held to the student code of conduct.
Okay. Lance, let's talk a little bit about definitions, terms. Talk to us about the difference between isolation and quarantine.
Well, there are two core definitions that come into play when we're having these conversations about COVID-19. Very important to keep those separate. Quarantine specifically refers to what an individual needs to do if they're high exposure contact, right? Not a known positive, but an individual who, using CDC guidance, would be deemed as a high exposure contact because they've been within 6 feet for 15 minutes or longer of a known positive. So that's quarantine. Isolation is what we would expect someone to do who is a known positive. Right, isolating during that contagious period and until they receive a release from the health department.
Okay, and I want to stick with you for a second. How does Healthcore, which we have our own, as you mentioned earlier on contact tracing team and folks help connect students to resources they need and academic support, but how do you work with the Fayette County Health Department, which also is doing contact tracing, right, and is helping with the entire county? Sure,
yeah, and of course the University of Kentucky and our main campus here fits within the jurisdiction, the area of the Fayette County Health Department. We work very closely with Commissioner Humbaugh and his staff. We meet on a daily basis, our Healthcore team and Dr. Humbaugh's team, to look at cases, positive cases together, make sure that folks who are on each other's radar are shared, and that we understand who's following up and providing support. It's also a great place that we can work through, hiccups and issues that some of our community members might be facing, and we can be good advocates for making sure that process runs smoothly on a Fayette County side through those daily interactions. So that they're key, they're ongoing, and that's a rich, sustained relationship.
Trisha, there are other needs that students have beyond the physical support, right, in the face of the virus. Can you talk a little bit about the mental health support that's available to our students during this time?
We absolutely acknowledge that this is maybe not the easiest environment to navigate and maybe hard on some of our students mentally. And so there's actually a number of different resources that have been put in place by the institution to make sure that we support our students through this environment. And so one of them being, if you live inside of the residence halls, there's actually an initiative called Wildcat Wrap Up, and this is an opportunity where any student who is being quarantined at this time can actually log on to a Zoom call. This initiative is supported by Campus Recreation, student organizations, Red's Life, and the Counseling Center. But you can actually log on Mondays and Thursdays during the hours of 3 to 7, and one of our actually our staff members from any one of the organizations that I just listed will actually be on the call, and they will initiate different types or facilitate different types of games, and but at the same time simultaneously have a group session to sort of talk through what the student may be feeling at this time, and also provide a number of different resources. This is actually a concept that's also available for students who are off campus and for students who are in isolation in any one of our facilities. And so on the counseling website, there's actually a COVID-19 support group, and it's a very similar concept. Mondays through Thursdays, you can jump on the Zoom call and talk to a counseling professional who will walk you through whatever it is you're experiencing at that time. So a really good place for students who may be struggling mentally to deal with this.
Great. I want to go over with both of you all some of those commonly asked questions that we're getting from not only students, but mostly students, but students and families and parents. So, Lance, I'll start with you. One question we get a lot is, should I wear a mask when I'm in a car with my friends?
Absolutely, yes. If in doubt in any situation, you should put a mask on. But particularly in a car with your friends, right? That you're in a closed environment where air circulation might be minimal. You're certainly in most cars you're going to be within 6 feet of others, and you don't know the status of individuals in that car related to COVID-19. So it's always a safe bet to have that mask on.
Great. All right, and Trisha, we get this question a lot. Why don't we have fall break this year?
Oh, that's a good question. So as some may remember, the academic calendar actually started this year on August 17th and will be ending in person, at least, classroom activities on November 24th. As a result of having to start the academic calendar a week earlier, we chose to move forward with having institutional instruction on both Labor Day and fall break. I think it's important to also mention, though, that the instructional days, the number of instructional days, are the same that it has been for any other academic year. So because we've had to move it up earlier, that's what caused us not to have a fall break this year.
And the university, I guess, today announced the calendar for the spring semester, which is somewhat similar in that, except moving back the start, but kind of compressing that calendar again, and no spring break, but the idea is to try to keep students on campus once they get here, right?
Absolutely, absolutely. So we want students to get here, be able to progress through their academic coursework, again, in a safe and healthy environment.
Okay. Lance, we were talking before we started about screening and the importance of screening. So talk a little bit about why students are required to complete that screening, and what should they do if they're, for some reason, not getting that email with the reminder about the daily screening?
Yeah, so the screener is yet another important tool used to keep our campus safe, right? If testing is key, which we know it is, as important is using that screener, and I think for a few reasons. One is it puts at the forefront of your mind every day when you wake up, what are my symptoms, who have I been around? And that's a good habit for all of us to be in. Secondly, the screener it's a dynamic screener so that if you answer either of the first prompts in a way that would send up a red flag and need some more information to provide advice, the following CDC guidelines, that screener will populate additional questions, sends us back that information in Healthcore that we can do follow-up on, but the screener will also give you a specific direction based on those answers, and that may look like seek medical advice. It may look like you should quarantine. So very, very important tool. And to the question of what do you do if you're not getting it, you can simply email healthcore@uky.edu, and we'll respond with a quick link that you can opt into that screener with.
Great. And let me stay with you because we get a lot of questions around numbers and symptoms and reporting dates, and and it does get kind of confusing because different places report different ways and communities report different ways. So is the isolation date based upon when an individual first starts having symptoms, or is it based on the date an individual tests positive?
So as these conversations often are, it's not a simple answer. It's not one or the other. It ultimately is the isolation date for symptomatic individuals is set on the date of first symptom onset. For asymptomatic individuals, that date is generally set on the test date, the positive test date. And that the sort of length of that isolation, I think this is where a lot of confusion and frustration also comes, is that the length of that isolation can be extended depending on if you didn't have symptoms and you develop them, or if you have continued symptoms and those don't subside within a certain number of hours before that initial isolation is set to end.
Great. And Trish, we've gotten some questions about fraternity and sorority life, where we've done some retesting. Are students in fraternity and sorority life, or what we call FSL housing, are they able to quarantine in UK's designated quarantine dorm, or should they test positive or be exposed?
So that's actually a complex answer as well. We strongly encourage if they have the space that they quarantine inside of their fraternity or sorority house, if that's where they choose to quarantine. They also have the option of potentially quarantining at home or any other location that they may feel more safe in. So in particular to quarantining, we encourage them to do that in the space that they're currently in the fraternity or sorority house.
Okay. And then what should someone do, giving you all the disciplinary questions, what should someone do if a faculty member or a course instructor is not complying with mask policy or other health and safety guidelines?
That is absolutely something that you can share with our office. We would, in addition to that, probably share that with the IEEO office as well as our Center for Support and Intervention. But one of any of the officers within any one of those particular departments would be able to address that. So we encourage you to submit a report. You can go on the Center for Support and Intervention website and actually find the link to make that report, and we'll make sure it gets to the right place.
Okay. Lance, some students have noticed a lag time in the time that it takes for contact tracers to reach out to potentially exposed individuals, as well as when a student is released from quarantine. Will that improve or change throughout the semester? Or talk a little bit about how that works.
Sure. So we do prioritize in our daily operation the notification of positive individuals first and foremost, right? So before we divert or shift staff resources to additional projects, we're making sure that those positive test cases that came in that day, that we're making the notification, we're making that plan for isolating, and we're making sure that they're, that they're well and taken care of. That process, depending on how many cases we get in the day, could provide a slight delay in finishing that contact tracing process and in notifying high exposure contacts. But rest assured, those notices are coming. They do come, and we work to do that within about a 24-hour time frame. So that's our aspiration that we're working towards on a daily basis.
And how has that, this is related, how has it worked in terms of the turnaround time for test results generally?
Yeah, so we know that somewhere between 2 and 3 days is the average turnaround time for test results from our Wild Health partner, that third-party partner. And our university health tests are coming in even a little quicker than that. So that's from the date of testing to when that test makes it back to us in Healthcore, and we've got something to act on. I think it's important to note too, folks who tested early on, and particularly in the throes of testing all students on campus, right? There were much higher volumes of tests coming in, and so at one point we were looking at longer return on test results, but again, we're just over 2 days now.
Great. And Trisha, if an individual has tested positive already for COVID-19 and they've been released from isolation, and we show on our dashboard exactly kind of those numbers every day, do university policies still apply to them then at that point, or how does that work?
Yeah, absolutely. So even though you've tested positive, you've been released, we still expect for you to be a good community member and wear your mask and be compliant to all the safety guidelines that we've put in place. And so it is an expectation as a good community member to follow all of the guidelines that we put in place, even after you've tested positive, because it's just also, again, showing that you are being a good neighbor and being supportive of your fellow colleagues and as well as students. So it does apply.
Great. And we're running up on time. I want to be sensitive to that. Anything you want to add about how the semester has gone, or how you think things are going in terms of this pretty awesome and large project that's underway on our campus this fall? Trisha, I can start with you.
Yeah, I would just like to acknowledge that I know initially when we talk a lot about compliance issues and disciplinary things, individuals may receive the impression that it's a lot. For the most part, the majority of our students are doing an excellent job at being compliant and really being good neighbors and supporting each other as well as themselves in this healthy environment. And so I'm just so proud of them and really look forward to not only this semester, but the spring semester as well.
Lance?
And I echoing Dean Clement-Montgomery, this is it is a fall semester unlike any other, and we are, we're working across unit lines to make sure that our campus stays safe and that we're pushing that importance of respect. And I'm continually amazed at the wonderful talent we have on campus moving in that direction, and the great efforts I think our students are putting into making sure that this is a successful fall semester. So, we're here for you as the Student Success Division, right? Our Healthcore team, and certainly don't hesitate to reach out if we can answer questions or if we can support you through this unique fall semester.
Great. Well, thank you all. I know how committed you all are to this and to our students. I know it's a 7-day-a-week project and job and commitment for you and your team. So thank you all for what you do for our students and our campus. And thank you all for watching another edition of this. We'll be back in a couple of weeks with more about how the university is responding to the coronavirus.